Hello, I'm John Brewster, an osteopath from Keighley,
And I am Sarah Gordon, an osteopath from Harrogate.
and today we're going to talk about an acute knee, how to calm it down, settle it down, and then get into some strengthening exercises to regain better strength and ability through it. First of all, we'll talk about some contrast bathing, which we have done in length in another video. We'll briefly go over that now.
So basically, if your knee is sore and swollen, you want to calm it down, one of the easiest things to do is get an ice pack from your freezer. This is an ice pack that we sell, or you could use a bag of frozen peas, a bag of ice cubes, wrap it in a tea towel, put it on the sore area of the knee for 3 to 5 minutes, that's all you need. Take it off, put on a hot water bottle for again about 3 to 5 minutes till it heats up, alternating the hot and cold, starting cold, finishing cold, for a total of about 25 minutes.
Once you've done that and got the circulation into the area, so the circulation is bringing in the good stuff and washing away the gunk, you can then add in maybe some anti-inflammatory gel, work it around the joint line and work it until it goes into the skin for a little 5 to 7 minutes. Once you've worked that in, then from the inside out you can take some paracetamol, tablet wise, and you can also add in a homeopathic element such as arnica, rust tox and rutagrave. The arnica is the important one because it's an anti-trauma that calms the bruising and trauma of the knee down more quickly, and you get those in a homeopathic formula tablet-wise. Then in the exercises, we've got a few to calm the knee down initially.
Yeah, so an exercise that I recommend to my patients is something called the custard stirring exercise. For every joint in the body you have major movements and minor movements, and you need both of those to be working well for a joint to function effectively. In the knee you have extension and flexion, but you also have a little bit of internal and external rotation of the tibia on the femur. So this exercise, custard stirring, helps improve all of that. So I'll just demonstrate on the chair. So if you sit down on a nice comfortable chair, lift up your sore knee slightly off the chair, then if you just imagine that in front of you on the ground you had a big vat of custard that was really lumpy, and your shin was like a big spatula, so you're just basically moving your shin around in circles in both directions, which causes a bit of flexion extension, internal and external rotation. So that's a really good exercise for loosening the knee, and by all means do your other knee as well, so you just feel the difference in that. But that's a really good gentle way of loosening off a sore knee. The other exercise, just to strengthen up the inside of the knee, because sometimes usually when you have a sore knee, the muscles on the inside in particular start to waste. So to strengthen up this VMO, it's called vastus medialis oblique, a very simple exercise you can do quite regularly is sit on the edge of your chair, put your leg out straight in front of you, turn the foot out so your foot is pointing outwards, which engages this middle muscle, and then just do some little straight leg raises, maybe do 10 at a time, and then rest, and then when you remember again do another few 10, and that just helps strengthen up the inside of that thigh there. Yeah. Oh yes, some other exercises that are quite good for the knee, but you may not be able to do them at the moment with the coronavirus, but if you can get to a swimming pool, if you can get yourself into waist deep, standing up in a swimming pool, walking up and down the pool, that gives you a full range of motion for your knee, but because the water is supporting your weight, it's much more comfortable for your knee to do it. Also, you could do simple exercises like squats or a one-legged squat, which helps again build up a bit of muscle strength and also gets a full range of movement, but without the full weight bearing of your whole body, so it should be easier.
Once you've got the knee a bit more settled and calm, you can then do some slightly stronger strengthening exercises. One I call a cross-legged exercise, and it works both the quadriceps and the hamstring muscles alternately. So if you've got a particularly sore knee and you bring the other leg across to it to keep it in a straight line,
That's just some building work next door.
then you can work on the quadriceps of trying to get the leg, take the knees as far back as you can, the ankles as far back and knees as you can, Get a nice squeeze between the ankles and take the legs as far out as you can. Straighten the legs, taking 6 seconds to get there, gives you the speed as to how fast to go, and 6 seconds on the return, putting as much resistance through that range as you go in a consistent or variable fashion depending on the pain. So if it hurts, ease off and then increase again when you can until you get it consistent strength all the way through, fully back to fully straight. And then once you've done 12 on one side, you can then change over, again taking the other leg across to it, as far back as you can underneath you, squeeze between the ankles and taking the legs out as far as you can, 6 seconds straight, 6 seconds to return. On a lower chair, if you push yourself to the back of the chair and slightly lift, you should be able to get the lift to clear the feet of the floor as well, to allow you to do that exercise. And if you can do 12 on one side and then 12 on the other side and repeat that 3 times, you can build up to that. That'll nicely build up all the strength of the thigh muscles.
Can I just ask, do you need to bring the foot in front or behind?
So you're going to do both. You're going to bring the foot in front of it first to work on the quadriceps.
Okay.
And then you're going to take the foot behind you to work on the hamstrings.
Okay.
And of course you're going to work also the opposite muscles on the other thigh as well, beneficially. That's a non-weight bearing exercise for the knee. Now a safe weight bearing exercise, because again, once the knee's sore, weight bearing exercise can be quite sore on the knee. If you just do a stand, and put the weight on one leg, try and keep the balance. If you can't keep the balance, put the other foot behind you a little bit to aid a bit of balance support, and then you're just going to put most of the weight on this leg you can manage and do just 45-degree bend of the knee, keeping the parallel right angle marks of the shoulder girdle, spine straight down, pelvic girdle going down, and you're trying to keep the kneecap over your second or third toe if you can, so you're descending in a nice straight line. If you can do 10 or 12 of those, and then change over and do the same on the other side as well, that'll add a bit more weight bearing and strength through the thigh, and particularly in that first range of movement, which Sarah's mentioned is important to try and keep that vastus medialis working well. Finally, the last little bit is, again, if you feel up to it or you can get your hands on an exercise bike, a rowing machine or a cross trainer, because they have a pedal on them, allows a nice safe vantage point for the foot and leg to work through without any different sort of troubles with balance and things. An exercise bike you can work on, nice height to the saddle, making sure a good strike through the leg as you're working through the full motion of the leg. And we can do an extra video on those 3 areas to develop those ideas with you more if you would like to.
And then finally, the 4 main muscle groups that cross the knee are the quadriceps, the hamstrings, the adductors, which are on the inside of the thigh, and then the calf muscles. And it's probably a good idea for your ongoing knee health to just stretch those 4 groups of muscles occasionally, if not daily. So to stretch the quads, what you would do is hold on to a chair, lift your foot up if you can, in fact I'll turn around, hold your foot behind you, so you're stretching out your quads, you're trying to keep your pelvis engaged, your knees together. But not everyone can do that, but if you feel you can, give it a go. Then you can stretch out the hamstrings by doing a sort of a straight leg. I don't know if you can see me there. Putting your leg in front of you and bending forwards, and that stretches out your hamstrings. To stretch out your adductors, you want to take hold of a chair or a table, bring your legs apart, and then stretch. If you lean forward, that stretches the inside of your legs. And then finally, to stretch out the calf muscles, which everyone forgets, you just step forward again and lean on something and stretch your heel backwards, so you get a good stretch of that calf muscle. So basically it's the quads, hamstrings, adductors, and then calf. Okay? I think those are the main
areas for the knee strength, so calming the knee down from a sore, inflamed knee.
So like any joint in the body, it needs flexibility and it needs strength as well.
That's it.
Okay, right.
Thank
Thank
you.
you.